let me say for the record that these appointments were made on the basis of the merits and the performances of these nominees in the examinations that we conduct for persons seeking to hold the office of permanent secretaries in the public service of Lagos.
Sir, I want to assure you that this appointment will be guarded jealously. We will be at our best and we will give our best at all times, and we can be sure at any time of our unalloyed loyalty to our nation.
The Lagos State Governor, Mr. Babatunde Fashola, has appealed to the federal government to take concrete steps to address the traffic gridlock at the Apapa axis caused by disorderly activities at the Apapa ports. Governor Fashola made the appeal during the visit of members of the Senate Committee on Privatization to the Government House, Alausa. The Lagos State Governor said the vehicular congestion, which is at the root of the gridlock, was driving away businesses and discouraging investors from settling in the area. The chairman of the committee, Senator Gbenga Obadara, said they were in Lagos as part of its oversight functions to supervise some privatized government assets, adding that they wanted to see the gridlock in Apapa as a first step to finding lasting solutions.
The committee decided to come to Lagos because we knew what is happening in Port. We are not generating the required revenue. We sat together when we were there. A situation where the place is concessioned and you are giving us $66,000 a day by an operator. What can we do? Lagos State will not even have their revenue complete from federal, like any other, the remaining 35 states. So we're able, because we just don't want to sit in Abuja, then tell them, bring your books. We really decided to interface to know their problems.
What we are going through now, over 90% of the cargo that comes into Nigeria by sea passes through Lagos roads and then goes all across the north. If those roads collapse, the economy of this country will take a massive hit. Sometimes chief executives of companies will call me in the evening that they are trapped in their office and they can't go home. So we have to send last mile there at night to go and make a way for them to go. And the people who make these decisions are too far removed from the reality. So that's why I say this privatization, they have consequences. And when we take those decisions, we must walk through the distance to see that the teething problems that come out are addressed before they become real cancers. So how does the concessionaire, I am told, shut out vehicles from the normal parking area designed into the port when it was built in 1908 or 1913, or when was that port built? Yeah. So why do you shut them out? So they now live on the street. So they bathe in the street in 21st century. Defecate in the open. So we went to clean all this mess. So when you tell me that things will change, I hope it will change. Because the federal government team was here when we went to clean up that place. And these were the kind of promises we made in public. If we had control, constitutional responsibility over that port, I know what we would do and we will solve that problem. But they came here and said, oh, yes, Minister for Finance, Special Advisor to President, and so many people came, and that was the last we saw of them. That was the last we had. I wrote a follow-up letter to make recommendations on next steps. We did not have even the courtesy of a reply.
So welcome back. We begin this segment with health issues. Now, if you are a goiter patient, our next report may be good news for you. This is because the Lagos State government, through surgical intervention of the goiter control program, is offering free surgical and treatment to affected people.
The health intervention scheme was necessitated by the high number of people with neck swellings among local residents who came to seek medical intervention during the free medical mission conducted in Badagry in 2013. In the first phase of the intervention program, 48 people will undergo surgical treatment free of charge.
I am happy that we started the intervention in the primary health care centers across the local government. And what we are here to do today clearly confirms the strength of that initiative, that robust grassroots health care can be very, very impactful.
For most of the beneficiaries who could not afford to pay for the treatment, this is a timely intervention.
We appreciate our excellency. We thank you so much because you've met our needs. We've been to various places. We've been to so many hospitals. Like of myself as an example, I've been to Cotonou for a series of tests. And I was asked to pay some amount of money, which if I converted it to our money here should be around 130,000. But due to the financial aspect, I could not meet up. But I thank God for what God has used you to do in our lives. Because if we are to say one or two things, I think you promise and you fulfill.
Governor Fashola took time to check out the facilities and patients who are already undergoing treatment at the center.
For all the cases that we have seen, it wasn't something that could be done at the local level in Badagry, so we've moved them to Lasut, which is a tertiary specialist facility, and they had to be accommodated in a hotel close by to prepare them for examination. In addition to what we have done here, clearly we've decided now to expand the scope of our primary health care mission, like the one we had recently in Ojodu, from diabetes, hypertension, HIV screening, dental surgery, hernia, to goiter surgery now across the state as we move forward.
Goiter means the gland is swollen. You could have a swollen gland and be normal, okay? Because in hypothyroidism, that's where you have more of the swelling occurring, and that's because there is deficiency of iodine in the patient system. Those that require surgeries are those that have complications of that swelling. For example, if the swelling is so gross, it could press on a nerve in the neck and affect their speech. They have hoarseness, they begin to talk like, or sometimes it compresses on their trachea and they may have difficulty in breathing. Okay? So when you have complications like that is when you now determine to have surgery, all right?
No, like we did say, one of the common causes of this is low iodine intake. But say, you can't come out fully because it's a bit unusual for that area. And that's why the second set of investigation we are doing is a survey, community survey. That one, we're going to interview members of the community. We're going to take samples of the food, samples of soil, take samples of urine samples from children to check their level of iodine, for us to actually determine what is causing it in that area. It's when you know what the cause is, you can design how to prevent it.
I've discovered it since 1997, but it's not up to this. It gradually comes up. So later, we went to General Hospital for a series of tests. So we were placed on drugs. Kyberoid and some other drugs has been taken for years. Just for everything we discover is growing more.
Apart from surgical intervention, the exercise is also aimed at creating the awareness for preventive measures that will reduce the prevalence of the disease, determine those patients that are more suited for the treatment with drugs, and provide selection criteria for patients more suited for surgery.
It's no news that Lagos State has been at its best in terms of infrastructure development as the state continues to deliver completed projects. this time around in Etiosa local government area.